this case, we're going to focus on a complete knee replacement, also called a total knee replacement. Why does someone need a total knee replacement? Usually the driving factor is symptomatic arthritis. What is arthritis? Arthritis is wear and tear away of the cartilage of the knee. The cartilage is what caps the two ends of the bone, and that cartilage can wear away for many reasons. It can be just regular wear and tear. We would consider that osteoarthritis or degenerative arthritis, or that cartilage could have been worn away from some type of trauma. So the actual surgery itself, you're asleep, you can't feel anything. We make an incision in the front of your knee. That allows us to get inside. We have to get inside the joint. What's the problem? It's that worn out cartilage. So what we're gonna do is we're gonna cut that out. We're gonna make some smooth bony cuts on either side of the knee, both the femur side and the tibia side. And then we're gonna cap the ends of the bone with metal, nice smooth metal. Typically we're gluing those metal components in place. We use something called bone cement. That makes it immediately stable. Between those two pieces of metal, we're gonna put a nice smooth plastic liner. This is a very high engineered plastic, okay? It's super wear resistant. That thing's gonna last a while.